The government continues to defend former Health Minister Dr. Fenton Ferguson. The Portia Simpson Miller administration is insisting that it did not do anything untoward by transferring the former Health Minister from the Ministry of Health to the Ministry of Labour and Social Security. The embattled minister has been facing harsh criticisms for his handling of a bacterial outbreak in 2 public hospitals that killed 19 premature babies. The opposition JLP and some members of civil society say Dr. Ferguson should not be included in the cabinet. On Tuesday, the president of the Jamaica Manufacturers Association, JMA, Metri Siaga, expressed disappointment with how Prime Minister Portia Simpson Miller has managed the issue. Mr. Siaga argues that no one has been held accountable for the deaths of 19 newborns, but the government's chief spokesperson says the Prime Minister has already acted.
You heard the new Minister of Health last night, and he has to go in, he has to do his own assessments, and we have to look at where the breakdowns happened, and based on that we can't just fire people without knowing whether or not someone did something wrong. There is a process, and I'm sure the Minister will do his assessments and take his decisions.
Addressing journalists on Wednesday at a Jamaica House press briefing, Information Minister Sandra Fortner insisted the Prime Minister listened to the concerns expressed by citizens. She says those concerns guided the decision to reassign Dr. Ferguson.
I think the Prime Minister was very clear in her statement, and in her statement she said that, we have to move forward, avoid the distractions. What we really have to focus on now is the economic reform of the country and ensure that we do everything that is in the interest of building our economy, and the distractions were affecting that process.
So Dr. Ferguson's reassignment was just to get rid of a distraction and not based on any...
Well, we listen to the people and we listen to the concerns of the people, and the general view from the population, they had some discomfort, and we answered their questions, and we answered them. So Minister Ferguson is in a new portfolio, and he is raring to go. He's going to do his work, and I think we should allow the 2 ministers to settle down.
Meanwhile, newly installed Health Minister Horace Daly has already made it clear that he will be holding his regional health officers accountable. The audit into the health sector has revealed that several theatre rooms in hospitals are poorly kept. It also indicated that the janitorial staff isn't provided with the required chemicals to sanitize floors. So is Minister Daly's position shared by the cabinet?
Well, I believe that all of us have jobs to do, and all of us should be held accountable, whether we're a clerk, whether we are a CEO in the process, if we're a nurse or a doctor. Every single one of us they have jobs to do, and they should do their jobs, and they should be accountable to the people that they serve.